This is the #1 most underrated tool to improve your nervous system health. So that tool is called heart rate variability. You might be aware of it, you might not be. Very commonly now to be used with athletes, but the everyday person hasn't caught on yet. Now, people with whoops, O-rings, they have it, but they're not super accurate. So you need to get yourself one of these. This is a super accurate heart rate variability measure. Now what that does is it shows you how in your fight or flight response you are and how much is it affecting you and how ready you for the day or the weeks to come. So come on over here. I'm going to show you exactly what I show to all of my patients. So we have 4 zones, 5 zones actually. And the first zone is the green zone, which is great. We want to be here. However, most people don't fall in that zone. Now, what we have are 2 different nervous systems within our first nervous system. The first is our sympathetic, which is our fight or flight response. That you got to imagine is like a gas pedal. It makes things go faster. Whereas on the other side, we've got our rest, digest, and heal, which is like a brake pedal. Now what that does is it slows things down. It allows you to heal and it allows you to recover. If you start in zone 1, this means you have high energy, but you're very sympathetically dominant, which means you're probably an athlete. A lot of athletes, they do a lot of exercise 6 to 8 times a week. They've got high energy, but their body's not recovering and resting well. So it's really common to be in that. The job here is to become more balanced and to get more into that green zone. That's going to allow you to rest, recover. It's going to allow you to train harder and not be injured. The normal, average, everyday person lies in the zone 3. Now what that means is you're sympathetically dominant, your fight or flight freeze response is very high, but you've also got low energy. So symptoms of people in this category are low energy, low mood. They feel like they constantly stressed. There's a lot of sicknesses going around. You find that you might be prone to illnesses, things like that. So the job there is 1, improve energy. That's going to be through sleep, it's going to be through nutrition, it's going to be through adjustments, and then also improve the balance. So making sure that you're able to recover better. Okay, so then we go over to zone 2. This one, not as common, but essentially when we start getting to zone 2 and 4, this is when we start getting parasympathetically dominant. Now, a lot of people don't actually know what that means. It means your fight or flight system has been working so hard for so long, usually years, that it starts to fatigue and it's not working so well. So that usually means that the adrenal function's lower, the cortisol in the blood is starting to get lower as well. And most of the time, people start to feel exhausted. So up here in zone 2, you've still got high energy, but the body is starting to exhaust and people start to feel a lot of different symptoms such as tiredness, fatigue, burnout, stuff like that. Okay. Now when we go to zone 4, this is the one that we really don't want to be in. This means you've got low energy and low function of your nervous system. Now, usually when you're in this zone, that usually means that you've got another condition. So a chronic inflammatory condition, maybe a Crohn's disease, it could be depression, anxiety. Usually people in this zone 4 are getting help through the medical system as well because their body is just not able to be resilient to the everyday needs. The job is be balanced, be healthy, have high energy, and you'll be good. So get one of these, it's going to help you a lot. It's going to be able to monitor where you're at and to see how you need to change your everyday life to be able to suit what your body needs so that you can thrive more.